Good morning everybody, Nina Marnie. Welcome to the virtual launch of the SA Heaps Unfair report. This is a joint report from the South Australian Council of Social Services, SACOS, and the Southgate at Flinders University. I want to start by acknowledging that I'm on the unceded lands of the Kaurna people. I want to pay my respects to their elders past, present and emerging, and I'd also like to acknowledge all the Aboriginal and Torres Strait Islander people who may watch this video in the future. Of course, this launch is virtual because of the COVID-19 crisis. But you know, it's all the more important that we look at the recommendations and findings of this report because inequities are shining out in this epidemic and they will be a crucial part of the response. We'll be responding to those. Online, and we will give you at the end of this the link to a summary, final and statistical report, and also you can find it on the Southgate website. The project was started when we became very concerned that about the data on growing inequities that John Glover and his colleagues at the Public Health Information and Development Unit were producing. The good news is that life expectancy has continued to grow for all groups, but the gradient in premature deaths between groups is increasing. How health is distributed in our state is becoming less fair, and people living in better off areas are living longer than those in less well-off areas. This has always been the case, of course, but in the last 30 years, things have been becoming steadily more unfair. And now, the most socio-economic disadvantaged areas in South Australia experience twice the rate of premature death than the most well-off areas. Now, our report has explored why the gradient of health inequities has increased. We've done this based on interviews with key policy actors who know South Australia well, and also a World Cafe workshop with participants from government, community organisations and universities that has helped us refine our findings and also our recommendations. We found 5 key crucial themes that might explain why health inequities are increasing. First of all, the deindustrialisation and changes to work. That includes the loss of manufacturing jobs, Holden, Mitsubishi and all the associated industries. Gig economy jobs are growing, incomes have been stagnating, and up until the COVID-19 crisis, a freezing of government allowances, such as the Job Seekers Allowance. There's also been widespread privatisation in education, health, public infrastructure and the housing sectors. There has been a decrease in the amount of public housing available. We used to have an SA housing trust that provided a much higher proportion of housing, and there's been an increase in living costs like rent and energy, and of course increases in income and wealth inequities. We've also noted as our fourth trend, our fourth theme, that there's been a politicisation and hollowing out of the state and federal public sector capacity. There have been many cutbacks, there have been outsourcing that mean that our public sector is weaker than it was and less able to develop policies that would be designed to reduce inequities. The market generally doesn't do that. And then finally, the fifth theme is a more general erosion of democratic social justice that we've observed. And this has included a disinvestment in community-based approaches to health and education. It's shown by the rising tide of individualism rather than the values of solidarity and collectivism. It's shown by more consumerism. It's shown by the competitive tendering that pitches NGOs against one another, and in the wind back of the use of community development strategies. For example, community health centres used to do a lot of community development and they no longer exist. NGOs are also having to compete for funding, and often the nature of government contracts restricts their ability to do advocacy. So that's our 5 themes. We've also made a series of recommendations, and these are much more relevant as COVID-19 hits us. Ross Womersley will be expanding in those a little later in this video, but I just want to talk to one. Our community health centres were cut, and the state government has withdrawn from much primary health care. And I just want you to imagine what our response to the virus could have been if those centres were still open. They could have acted as COVID-19 local response centres for testing, information and help with screening. And they could have been a point of contact for people who are concerned about their health. So our recommendations stress the importance of a strong public service. That's absolutely crucial, and Ross will tell you more about those. And finally, just to say, reducing health inequities requires us to put the emphasis on our collective well-being, to strengthen our public sectors and ensure that government decisions are made on the basis of what impact they will have on health inequities. This is always true, but certainly more true than ever as we join together to fight the COVID-19 crisis. I just want to remind you that you can follow our launch, our virtual launch on Twitter on the hashtag #SAHeapsUnfair. That's hashtag #SAHeapsUnfair. So please join us in the Twitter Fest and please download copies of our reports. Thank you very much and good morning everybody.
G'day, I'm Ross Womersley and I'm the CEO of SACOS, the South Australian Council of Social Service. I'd like to begin by acknowledging that I'm streaming to you today on the lands of the Kaurna people. Always was, always is and always will be Kaurna land. And I pay my respects to elders past, present and emerging. The report we're launching today with our colleagues from the Southgate Institute is due in part to SACOS's strong and abiding sense that many face unnecessarily harsh health issues due to socio-economic factors. Not everyone will be aware of the correlations of poor health outcomes with unstable income, but the Heaps Unfair State report highlights this with precision and from new statistical research. It's of utmost importance that we investigate not only how health inequities impact on those who are missing out on adequate health care, but how unequal health outcomes are an integrated system of economic, government, education and housing challenges. We've faced a very strange past few weeks with COVID-19 and are yet to fully understand the impact of how this will affect us. What we've seen reflected very quickly is that the global trend in underemployment and underutilisation rates, lack of accessible healthcare and lack of adequate social security payments are hurting us immensely. We are struggling to recalibrate to a society that can distance itself and yet stay connected, that can share resources during disasters like bushfires, but is coming to blows over toilet paper or someone's race in a situation like COVID. Many of the actions that we've seen in response to this dreadful virus arise from fear. We're now in a rare time where more people are afraid of poor health and morbidity than they normally would be. Imagine though if you lived with this fear all the time. The Heaps Unfair report shows that the rate of premature deaths in the most socio-economically disadvantaged areas of South Australia is now over twice the rate of premature deaths in the most socio-economically advantaged areas of South Australia. And this was a finding pre-COVID. While this report highlights the drivers of inequities, it also suggests a number of recommendations that we think are really worth taking seriously, particularly at this time when we're experiencing a communal fear of unknown outcomes. Firstly, to achieve any of these better outcomes, our South Australian government has to have the money available to invest in the vital services that we require and need as a community. And the only way that this can happen is if they can maintain and build an adequate state tax base to fund those services. We can only ever have a strong response to issues like this virus if and when we have the right community infrastructure in place to protect public health. Within our health sector, we have a range of things that we need, like we have to create a statewide health equity monitoring and policy system. We have to establish a program of comprehensive primary healthcare centres across South Australia. We need increased investment in critical areas like early childhood development and early intervention. And we need to target more funding to specific groups like the Aboriginal and Torres Strait Islander community-controlled health services. We must also expand the South Australian Health in All Policies initiative to enhance intersectoral collaboration so that health really is being thought about in all aspects of community and government life. Further to this, the COVID-19 crisis has really underlined how vital it is for us to urgently address the digital divide. In the health sector and in all aspects of daily life, digital inclusion is of critical importance, particularly at this time. Just reflect for a moment on those pictures of long queues of people trying to access their Centrelink offices, or indeed the collapse of the online platform because it was never designed for so many people trying to access it at once. As we continue in self-quarantine, isolation and schooling from home, it's going to become ever more evident that we need to enact strategies to ensure digital inclusion so everyone can benefit from these new digital platforms and technologies. As well as being connected online, households need to remain connected to essential services. Our energy companies and governments must do better to support waged poor households, tenants and other people living in vulnerable circumstances. The needs of low-income households should be prioritised as highly as any other household. Instead of focusing on the economy from a simple profit and loss point of view, we need to consider the economy of social justice and what this adds to us as a people and as a community. It's time to introduce a concept of a wellness budget, to adopt alternative ways to measure South Australia's progress, and to ensure that social infrastructure is afforded just as much importance as physical infrastructure. The soon-to-be-released SA infrastructure plan must include plans for metropolitan, regional and rural areas of South Australia that go beyond the installation of roads and buildings to thinking about the other forms of infrastructure that help communities thrive rather than just survive. We have to make renewed investments in well-located, energy-efficient and affordable housing. We need a deep investment in public housing because housing and its quality, of course, plays such a strong role in determining people's health and well-being. We also need to ensure that all South Australians have enough money to meet their basic needs, whether they're receiving allowances, juggling employment prospects, or employed consistently. This will mean indexing all social security payments to the average wage index at a minimum and ensuring that they maintain pace with community standards. It means permanently raising the job seeker, youth allowance and other social security payments to reduce poverty and health inequities. It means supporting a single parent supplement benchmarked to the cost of children as they age, and abolishing compulsory income management systems. Finally, in the community and non-government sector, the state and federal governments must increase the availability of these vital community services. Establish a set of values in all government contracts that recognise the long-term unique contribution to community development that so many of our not-for-profits and NGOs make. And we also believe they should provide SACOS with the resources to enable us to coordinate the development of a long-term plan for the community and non-government organisation sector in South Australia, one that incorporates workforce development, considers what the South Australian community sector should look like and how it differs from but can also complement the important work of our public sector. I'm proud of the report that we've produced. I will be far prouder if we can use it to leverage action that ensures our governments and our communities live up to the recommendations that we've made. What better time to start making these necessary improvements than now? With my thanks.
Hello, and I'm terribly sorry not to be there in person, although no one I suspect is being there in person in our new abnormal times. And the reasons I am not there speak loudly to the issue being challenged by your new and important report. South Australia and much of the world continue to become more unequal in both health outcomes and in access to the social, economic, and environmental resources that determine health. It should be no surprise to anyone watching or listening that the new COVID-19 virus that is wreaking health and economic chaos in countries around the world will inevitably hit people and countries in the most vulnerable, most unequal conditions. In South Australia, this will include many of the groups your report itself identifies: the unemployed, the gig workers, those facing diminishing social protection measures. As in other high-income countries, our public health systems have been eroded. We have looked to markets and to private providers to offer care, transforming ever more of our humanitarian essentials into profit-making ventures. Public taxation as a percentage of economic wealth remains well below levels 40 years ago and continues to fall in many parts of the world. The over-consuming wealth of a small handful of global elites that one can almost count on one set of hands and toes is greater than that of the majority of humanity. Where Australia's bushfires of recent months are harbingers of a climate change countdown likely to hit its apocalyptic deadline within most of our lifetimes, and where huge swaths of our fellow sisters and brothers struggle in refugee camps and informal settlements, fleeing violence, famine, and a soul-crushing poverty that no amount of rejigging of the World Bank's extreme poverty lines can make arithmetically invisible or less painful. That is the millennial new world in which COVID-19 emerged, and which in 2 short months became the world's most serious pandemic since the 1918 flu. Crises, of course, can be transformative. And what are the lessons our new pandemic so far has taught us? First, that our market-driven model of globalization is highly vulnerable to shocks and can unravel with remarkable speed. Second, that our political systems remain short-sighted and too quickly forgetful of the need to plan for the health and economic volatility we have been living with since the early 2000s. Third, that without strong and well-funded public systems, financed through redistributive taxation policies and with well-regulated financial and labor markets, all but a small minority of the 1% will face increased health and social vulnerabilities as the present COVID crisis passes into a likely deep and disequalizing recession until the climate crisis resumes its existentially threatening trajectory. But as your study points out, we know what we must do. We know what policies need to be in place. We know what economic practices need to change. We know what public programs need to be strengthened and what infrastructures need to be rebuilt. Your report focuses on a small slice of human geography and population, colonization, and settler history that we call South Australia. But its recommendations are nothing less than a starting blueprint for a new social order. The COVID crisis presents all of us with the opportunity, indeed the absolute necessity, to promote that new social order to the loudest and greatest extent possible. A century ago, writing around the time of that earlier global pandemic, the Italian philosopher Antonio Gramsci wrote of how an old world is dying and the new world struggles to be born. Your report roadmaps that new world and makes a small but vital contribution to its struggle to be born. Do not let your governments forget its important messages once the current COVID crisis subsides. Thank you for allowing me to speak to the release of this wonderful new report.